Happy Friday, everyone. So before I get into explaining the basics of Medicare, so Medicare Part A, Medicare Part B, Part C, and then Medicare Part D, I just want to explain the red shirt. So today is Friday, and in my little hometown here, our mascot is the Red Devils. Well, I've got two daughters. They're both 7 years old, and the oldest one, she's adamant that you wear red on Red Day, which is Friday. So that explains the red shirt. And now we're going to go ahead and get into the basics of Medicare. Before that, I want to just show you a little picture of my family, and then we'll go from there. So I really believe in developing a relationship with my clients. I like to get to know them, and I also like them to get to know me. So I just want to show you this quick picture of my family. This was taken last December, and as you can see, youngest to oldest, that's our wonderful new dog Bella. She's as sweet as can be, but a little crazy, kind of like our daughter Addie here, who is just a bundle of joy, full of excitement. And then you have Kenzie, who is just an incredible, sweet girl and brilliant, kind of like her mom. And her mom, my wife Tara, she's the glue that keeps this family together. So we're going to go ahead and get started on Medicare Parts A, B, C, and D. Part A, that would be your hospital coverage. That's going to cover basically anything that happens in the hospital. Part B is your medical insurance. So that's going to cover things like doctor visits, outpatient facilities, and lab services. Now, for those of you that have heard of Part C of Medicare, those are Medicare Advantage plans. They'll often include your prescription drug coverage, and they are typically HMOs and PPOs. So you're tied to networks as far as where you can receive your health care. And lastly, Medicare Part D, that would be your prescription drug coverage. That is not administered by the federal government. Those are administered by private insurance carriers. So typically these Medicare Part D plans have a deductible, not all, but most of them. They all have different formularies, different plan designs. So it's really important when choosing a Medicare Part D plan, not just to look at the premium, but also to explore if your particular Medicare Part D is going to cover your particular medications that you're on. So now that you have a better understanding of the Medicare basics, click the link and let's have a conversation about your Medicare options. Or just give me a call at 1-800-779-0128. That's 1-800-779-0128. And I can't wait to hear from you.